Hi, my name is Chris Rawls. I'm presenting this PowerPoint on long-term care facilities. Long-term care facilities are designed to provide continuous care for patients that are chronically ill or disabled. Long-term care facilities focus on providing individual care and coordinating services to promote the patient's quality of life and promote their independence. Long-term care facilities provide care to people of any age, but most commonly for the older population. MedicineNet.com defines a long-term care facility as a facility that provides rehabilitative, restorative, and/or ongoing skilled nursing care to patients or residents in need of assistance with activities of daily living. Long-term care facilities include nursing homes, rehabilitative facilities, inpatient behavioral health facilities, and long-term chronic care hospitals. This paper will describe the many types of long-term care facilities there are that provide the care needed for the chronically ill or disabled in their rehabilitation process. The paper will further identify the sources that can be used to meet legal requirements of operating a long-term care facility, including licensure and accreditation. Highlights of the evolution of the payment methodologies used by the state and federal government, including commercial insurances and some of the reimbursement issues that are encountered. In conclusion, a local facility for long-term care is depicted to further educate the reader on a community resource that is available. Payment methodologies. The prospective payment system. Payment is based on an average cost of treating patients in a category based on Medicare severity diagnostic-related groups. Skilled nursing facilities are cost-based payment systems based on prospective payment system, per diem rates adjusted by case mix and geographic variance. Inpatient psychiatric facilities. Cost-based payment systems reimbursed at per diem rates using the DRG data. Long-term acute care hospitals, price-based payment based on long-term care, prospective payment systems, classifications of Medicare severity, long-term care DRGs, and average length of stay, usually greater than 25 days. Inpatient rehabilitative services, price-based payment is based on elements of the minimum data sets for post-acute care. Source of payment for long-term care. Medicare for elderly and disabled, Medicaid for low income and indigent. Supplemental secondary commercial insurances are purchased by the patient. Long-term care insurance, this must be purchased prior to the stay and prior to illness manifestation. Private pay, interpersonal savings, or also contributions from family and friends. Some of the reimbursement requirements. Medicare coverage restrictions. Care provided must be for skilled nursing care, medical care, or rehabilitative care. Transfer to a long-term care facility requires a physician's order, and transfer of care must follow a 3-day hospital stay. Observation days are not included. Accreditation. Obtaining accreditation indicates a facility is operating according to the standards set forth by the accrediting body. It further signifies the facility is licensed by their state and to comply with the rules and regulations of that state. The Joint Commission example of an accreditation body. Accreditation provides validations of facility meets standards, and accreditation is every 3 years and includes an on-site survey to evaluate the facility. This slide depicts the 2017 Florida statutes and federal regulations. To run a successful long-term care facility, it's prudent to research the relevant laws pertaining to the operation of the facility in the state which it will operate in. Federal regulations are specific details, directives, or requirements with the force of law enacted by the federal agencies necessary to enforce legislative acts passed by Congress. The Omnibus Budget and Reconciliation Act of 1987 requires nursing homes undergo a periodic assessment to ensure that residents are in a facility that is best suited for their residents' needs. The facility staff have to meet training requirements, and the facility is maintained and cleaned to industry standards. Categories of regulation, state and federal. Reimbursement, federal and state. Conditions of participation set by federal government. Residents ensure patients are safe from abuse, neglect, and needs are being met. Building safety and construction to ensure care is provided in a safe environment. Employees trained and licensed to provide the level of care necessary for the recuperation and recovery of patients. An example of a long-term care facility in Gainesville is Select Specialty Hospital. Select Specialty Hospital is a 44-bed long-term acute care hospital located in Gainesville. Select Specialty Hospital is affiliated with more than 120 acute care and rehabilitative hospitals and 16,000 outpatient clinics across the United States. Physicians and staff include pulmonologists, nephrologists, infectious disease, internal medicine, and radiologists. Ancillary providers on staff include occupational, physical, speech, and respiratory therapists, telemetry, dietitians, radiology technicians, and nursing services. Select Specialty Hospital provides services that include physical, occupational, respiratory therapy, dialysis, wound care, pulmonary ventilator weaning, neurological care, post-trauma or illness, infectious disease care, radiology including CT, X-ray, and echocardiograms. Procedures performed on site include PICC line placement and NG tube placement, chest tube placement, thoracentesis, bronchoscopies, and paracentesis. In summary, the purpose of long-term care is to provide patients with the comprehensive, individualized care and rehabilitative services required that will enable the patient to return their normal activities of daily living. Until the time that skilled nursing, rehabilitative, or medical care is not required, the resident is in the appropriate setting for care. If rehabilitation is not possible and withdrawal of skilled nursing services will not cause the patient's health to deteriorate, then care should be transferred to a custodial care facility, as this care is not covered by Medicare. Listed are attachments on the Code of Federal Regulations. Attachments on the 2017 Florida statutes. Slide 16 lists the references used for preparation of this PowerPoint. Thank you.